feel good. I knew that I wouldn't. I feel good.
AM 1220 KHTS, your hometown station. Make sure you go to hometownstation.com for all the latest and greatest in the Santa Clarita Valley. This is the Prima Pediatrics Healthcare Hour. Dr. Feldman is joining me in studio. Doctor, how are you?
Getting over a cold.
Oh, kidding. But luckily, you're a doctor, so you know how to fix that, right?
Or not necessarily.
Oh,
the
okay.
doctor who has himself for a patient has a fool for a doctor and a fool for a patient.
So how have you been? It's been a month. How have you been? How have things gone?
Things have been going very interestingly well. I believe last month we talked about how early influenza had arrived.
Yep.
It's now full swing.
Okay, we're in full swing. Get your flu shots.
Yeah, and loads of respiratory illness, and we are now seeing winter, even though it's not winter yet.
Yeah, technically, yes. Technically, it's not winter. You can go to primapediatrics.net for more information, or you can call 661-424-9000.
Yes.
661-424-9000 for more information on Dr. Feldman. But go to primapediatrics.net, or you can call that number, make an appointment, become a new patient. So there's several things we can talk about today. I have, but one thing is the wind.
Oh my God, it's horrible out there.
Yeah, so I used to work with kids. I worked at a child care. And the kids, when it was windy, the kids would just go insane. I don't know what it was, but anyway. Well, is there health risks involved with
it
wind?
certainly are. When it's windy like this, we usually expect the full office because it brings all the asthmatics in.
Okay.
So the risks to people with either chronic pulmonary disease as adults, who had been long-term smokers or even lung cancer or any other kind of lung problem.
Okay.
And all the kids who are asthmatics and those with chronic lung problems cannot tolerate this type of wind. And what happens, it kicks up the dust and everything, and even those of us who are mild asthmatics, forget it, we're dead meat. So if it's windy like this and you're an asthmatic, whether you're symptomatic or not, you ought to pay close attention to how you're feeling, because you may want to take your inhalers today.
Okay, and so what are some of the things? Do we stay indoors all day? What are we supposed to do to avoid flare-ups?
You go out, you do what you need to do, but if it's super windy like it is now, you might want to put on one of those little surgical masks.
Okay.
So that you can filter the stuff.
Okay.
Well, admittedly, they won't filter much after about 15, 20 minutes, but it'll still keep the sticks and stones and big dust particles out of your face. So that's number one. Be careful if you've got contact lenses. If it's windy like this, you probably ought to wear wraparound dark lenses, sunglasses, when you're outside, because otherwise you're going to get a corneal scratch today.
Or just avoid contacts. Just wear your glasses today.
That's another idea.
Yeah.
But it's the eyes, the nose, the mouth, the respiratory system. The rest of it is, who cares? It's nice. I mean, I wouldn't stay too close to places where there might be wildfires.
Yeah, that's all of California.
And then, of course, that's what usually happens. We get the high winds that blow in the asthmatics, and then they triple when the wildfires begin, because then the air is filled with horrendous stuff.
Oh, all right. So there's a little excerpt of what to do if the wind today. It's topical. That's why I wanted to bring it up. But we're going to talk about what you wanted to talk about, communication, and we're going to talk about that.
Yes. It came to me this past week because I was involved with and thought about a number of different things about the way patients and doctors communicate.
Okay, so we're going to talk about that after the break, right?
Okay.
Patient-doctor communication, how important it is and how it should go on the Prima Pediatrics Healthcare Hour on AM 1220 KHTS.